Hi there and welcome back. Let's review Raynaud syndrome today. That's a syndrome of marked intermittent vasospasm of the digital vessels of the hands or feet or both, causing numbness and pallor of the digits. Raynauds phenomenon is the syndrome occurring as a part of another systemic disorder such as scleroderma, rheumatoid arthritis, or cervical rib. As opposed to that, the Reynolds disease is the syndrome occurring by itself with no discernible underlying process causing it. Reynolds disease usually develops gradually, is bilateral and symmetrical, and rarely leads to complications. It is precipitated by emotion or exposure to cold temperatures. Reynolds phenomenon typically develops rapidly, tends to occur in older individuals, especially men, and may occur in a unilateral or asymmetric pattern. Reynolds disease or the primary Reynolds is a disorder of young women and occurs in about 5% of the population. Average age of onset is 31. Secondary Reynolds or the Reynolds phenomenon is much less common and tends to occur in older individuals, especially men. And about 1% of those with Reynolds phenomenon have a collagen vascular disorder. Let's talk about the signs and symptoms. And I took down here white, bluish, and red, and I'll explain in a little bit. So, characteristically, three color changes occur during an attack. First, the digits become white or the pallor as the blood supply decreases because of spasm. Secondly, the bluish discoloration or cyanosis develops due to the prolonged absence of oxygenated blood. And finally, redness or the rubber is seen as the spasm ablates, the arteries dilate, and oxygenated blood flows back into the digits. Between the attacks, there will be no abnormal findings in primary Reynolds disease. The patient may complain of painful blanching of the fingers and or toes with cyanosis and or redness developing later. Clinical evidence of an underlying disorder may not be apparent, and Reynolds may be present for 20 years before a disease such as limited cutaneous systemic sclerosis becomes apparent. However, systemic sclerosis will usually be apparent within 2 years of the onset of the Reynolds phenomenon. Talking about the known causes, usually the connective tissue disorder. The secondary Reynolds phenomenon is associated with a precipitating condition, and that is usually the connective tissue disorder. Exposure to cold or emotional stress precipitates Reynolds phenomenon events. Investigations are aimed at determining if there is any underlying etiology. A full blood count to exclude polycythemia, thoracic outlet X-ray, blood studies to cover ESR, ANF, cold rheumatoid factor, NA, lots of other details are out there that may be done depending upon as the doctor may seem appropriate. And once in a while, if needed, even the angiogram may be carried out to exclude any obstructing lesion. Treatment: avoid precipitating factors like avoid exposure to cold, or keep affected areas, trunk and head warm, like use of gloves. Calcium channel blockers provide relief and reduce frequency of attacks. Sympathectomy, that is the transection, resection or other interruption of some portion of sympathetic nervous pathways may be of benefit. And last but not least, low-level laser treatment for severe refractory symptoms. Complications commonly occur in Raynauds phenomenon but rarely in Reynolds disease. They include ulceration and trophic changes, tight, shiny, smooth skin with loss of subcutaneous tissue of the digits. Digital atrophy and gangrene may imply a more serious condition. Complications, if any, of acrokinosis and erythromelalgia may include disability, finger ulceration or gangrene, or progressive disease. Acrokinosis is an uncommon disease characterized by persistent kinosis of the hands and feet, whereas erythromelalgia is a rare disorder of unknown etiology in which the vessels of the extremities suddenly dilate, causing pain and redness in the hands or the feet. Prognosis. It depends upon the underlying disease. So, how do we underwrite? As far as underwriting goes, follow your company specifics, the underwriting manual that your company expects you to follow. Look for the underlying disease, underlying cause, the severity or the frequency of the attacks or the treatment, and coordinate all these details to arrive at the appropriate and the best offer that you can extend based on the info and the details and the medical records that you have in front of you. With that, let's take a break and see you soon. Take care. Bye now.